the patient creates an account, that task will come right into Pro. And your staff will have the opportunity to say, is this patient in my system or not? Okay? So they'll match it. If there's a match, great. That patient set up an account, authenticated. And if not, then we know this is a new patient.
Okay. So one of my staff have to do that?
Yes.
They'll get in a queue and they'll get
Yep. Now, the second way that you can do it is you can do what's called activation. So if you already have patient accounts in your system and you have email addresses, so I always recommend collect email addresses. Okay? Okay. So collect email addresses. You can create the accounts in the portal and then invite them to unlock it. So they already have the demographics in there. Now all they need to do is create a user ID and password.
And they can do that on our website.
Right, right. And the patient manages their own account. So if they forgot their user ID or their password, they can manage that themselves. And notice how it says this site uses HealthKey. That means that any patient that creates a user ID and password can log into any portal across the country. So not just yours, but any account. And that's important because when they start collecting information from different sources, they need to have all that data in one account. So they're one PHR portal account. But what's great about this is because that database or that personal health record is attached to your branded website portal, they're more likely to engage and use the PHR. Because it's attached to their document.
Is this hosted or do I host it in my data center?
We host it for you.
Okay, so
it's
all
in the cloud.
SaaS.
Yeah. You don't have to worry about buying servers or anything like that. So once you log in as a patient, you're going to...
But you didn't put a password in. What?
I know. It's a demo. If I had to do that every time, I'd be slowed down. Okay, so this is my patient page. This is where they get all their incoming messages. This is where they see any solutions that you have available for them to use. So if you had the appointment request available and I'm a new patient, I just created an account, I'm going to go request an appointment.
Yeah, let me see that.
Okay? So what they're going to do is usually large health systems have different broken down by location, okay, or department, and they have, they'll have a selection, they'll choose that, and then based on that selection, it'll choose which providers that you want to see or which department, what you're trying to do.
What if a doc isn't accepting new patients right now?
You can
this will be an existing patient, though, right? Yeah.
Yeah, you can take them off the list.
Okay.
They don't have to show up in the drop-down. Okay. But this just confirms and pulls up their full bio, and so they can say, oh, yep, that is the doctor I want to see. Great. At this point, what they're doing is they're just sending your scheduling team the widest availability that the patient has to want to see the doctor. So they might say, I want first available. I can do Monday, Tuesday. I can't do Wednesday, but I can do these other days. And preferred time, let's say morning. Mornings work for me. Reason for visit, coming in for cough or whatever. Most important, if none of this works, I still want to see my provider. Or maybe, you know what, I can see another provider, but I need to come in the morning because I work in the afternoon. You can put in any immediate contact information. Notice that pulled in my phone number from my registration.
We're professional PM. So,
well, this is their portal.
Pull from that.
Yeah, they've already entered this.
Okay, right.
They verify it and they're done. So very simple.
Okay,
that was very simple. It took 2 seconds.
How about scheduling an appointment like for a CT or an MRI or a hospital?
Hospital-based, you can have the location selected as that. Okay. So if they need to select a CT, they can select that.
And we have questions that center around a CT and not an office visit?
You can do that.
Okay. Is this the patient portal you guys are going to use for, what's the hospital information system you guys bought, Allscripts bought? Eclipses. Is this your patient portal for ambulatory?
This is our go-to patient portal.
This is it.
This is it. So what you'll start to see that this is from an ambulatory background. Okay. That one's from the hospital side, and they're going to start merging them together.
Okay.
So
all right, absolutely. But if I buy this product, you're going to enhance it.
Yeah. This is the go-to.
The hospital as well.
Yeah. All right. Okay. Now, once that happens, that is going to come right into your system as a message, just like any of these. So RX refill request, appointment request, questions. They come right into the system.
It's a web message. It's not an inbox message.
Well, it comes in as an inbox message, but it's called a web message. Okay. And then once you click on that, you'll see, just like it looks like an email, just about. Yeah. And and you see, hey, they're coming in for this time frame, any other information they gave you, and then you go to your schedule. I don't have a screen, but you'd go to your schedule, book that in, the exact time, and then confirm back with them. And that's an easy process. Once that's done, the patient gets an email that says you have a secure message from your provider. Please click this link and log in. And then they'll log into your portal. Get the message. Yeah, upcoming appointment confirmed or whatever.
Do new lab results come up in here too?
Yeah.
Like if you get a lab result, it'll show, hey.
Yeah, you'll see, a lab result now. There's actually going to be a second way that you can automatically send lab results if you want to set it up that way. So as a doctor goes through, I'll show you this, show you from a PHR standpoint. So let's say that the patient had some lab work done, and the doctor wanted to send them their lab result when it comes back. So when it comes back from LabCorp request, the doctor's going to review it. Once they review it, you can set it up to automatically send to the PHR. Okay, so normal workflow, it just goes right in. The second way, which is in use right now, is if you wanted to send just a message, everything's okay, you're within normal range, you would send that as a web message to the patient. And most of the time, doctors actually include the data in there.
And you said something will go to their email address saying, hey, you got a new message.
Right.
And then they'll go to the portal.
Right.
Hopefully there'll be a link there. And,
and that's for HIPAA reasons. You can't send patient-sensitive information over email. So now, this is their PHR.
Yeah.
Now, the PHR is the database attached to the portal, like we were saying before.
Yeah.
They're members right now in Maple Street Clinic in this demo. They'd be a member of your clinic. Now, if they were also logged in and a member of some other clinic, they would also see the information coming from that clinic. So they'd see another name under there.
Because you'll have our family practice, you'll have a surgeon there, probably.
Right.
And then you could have an oncologist, so you have cancer.
Right, exactly.
And then, so the hospital side, you're going to request a CCD, right? And you're going to request a CCD from Allscripts.
Yep.
And there's going to be dupes in there, like lab work.
I'll show you how this works.
Okay.
Right. Yeah, great question.
I'm like the glow in your eyes.
Great question. Okay.
Most people, when I say that, say, "Oh shit."
Yeah.
I mean, oh crap. Can you edit that out?
All right, so when I get all these different CCD records that are coming in, CCD import, clinical summary, or lab results, I got it in from Dr. Judd and from Dr. Smith and whoever.
Yeah.
Then the reason this is a personal health record, so absolutely, as a patient, I want to determine what am I accepting in, because obviously they're going to give me duplicates. If I have the same past medical history and I give it to two doctors and they give it back to me, well, I'm going to have all duplicates. So I can choose to accept this or do not accept. So right there I can say all or none, and also what we're working on is discrete, so I can actually select the individual pieces of data I want to come in. So when I view this thing, I can say, here's my medical history they're giving me. They're giving me some lab results, they're giving me a problem list, a medication list, allergies, past medical history, immunizations. Maybe the immunizations I already have in there, and I'm like, I don't want that one. So I would just select all these ones up here, and that would come in.
Okay.
So I do have the ability to select which areas I want to actually flow in.
Okay, so the patient would do that.
Right.
Okay.
Now, this demo doesn't show it, but any information that is approved from a doctor actually will be locked, so the patient cannot edit it.
Okay.
Right. Because the last thing you want to do is send them a bunch of information, they disagree and change everything. But this is their record, right? So if I add information, like if I self-diagnose as a patient, just say make up all this stuff, I can actually add that to my PHR.
Okay.
Nothing's stopping anybody from doing that.
Okay.
So if I wanted to add an allergy or a tree pollen allergy here, and I want to say, I want to add, I have breathing problems, itchy watery eyes, mild severity, started January, then I could add that or save that to my PHR. And I can build out all these different areas in my PHR, medications, conditions, allergies, surgeries, I mean, you name it.
Do you have a mobile device too? So at the doctor's office, what's my med list, and I can pull it up on my phone?
We are making this web enabled. We have some iPhone apps and iPad apps that we're working on. But it's not out yet. Okay, so this is showing some lab results in there that I'm editing. Again, you know, if these lab results came from a doctor, it would have a lock there, and I could not edit it. I could comment on it though if I wanted to.
Where does it come in again? Does it go? Does it first come in at that message center at the beginning and say you got a new?
Yeah, okay. And that's so you can triage it. Okay. So it doesn't all just come in and you're like, what is all this? You know?
And sharing looks like you can share it.
Yeah.
So I'm a caregiver for my 100-year-old grandma.
Right.
She could share.
Well, no. Sharing is like sharing your PHR with someone else.
Yeah.
Before everybody's connected as a doctor, and I'm a patient, if I go to a doctor that's not connected to anything and they need my information, I can at least give them access to my PHR.
How about as a caregiver though? So 100-year-old grandma, she's got a med list 20 long.
Okay, great question.
How do I, as her caregiver, every time we go to the ER, go to the doc, what meds is she on? And I want to be able to just go on, print it. And
she can share that with you.
Okay.
Or there is a way, and I'll show you in a minute, where you can actually link your account. Okay. So we have a lot of like sons and daughters that have elderly parents or kids. They link those people under their portal account. Okay. And you can actually change. Let me go through the pro side of this. On the lab result, their normal workflow, they'd approve these labs. They would see the review labs and they'd see what they want to review. They'd say publish, yes, with read receipt. Let's say I wanted to add a message to that, or annotate, I think is what you click on. You can say, hey, you're okay, everything's in normal range. You're adding a message to the result to say, hey, everything's fine.
With read receipt though, so when they read it, you get a...
Yeah, because you want to know if they picked it up. Now, this is just showing, you know, the information that's stored in the chart here that, hey, you know, you sent that assessment or whatever. Okay, now, here's the change user. So if I have a family and I don't want to remember their passwords and usernames, I can just link them under my account. And when I click on Maya's name there, I actually become Maya, logged in. But I don't have to remember her password because she let me attach her. And that's how you can have access to her PHR or whatever else you need. Okay, let's talk about prescription refill. Same thing. So a couple steps. I'm gonna choose my provider, my location.